Hi, can you hear me? Hi. Can
Hello?
you hear me? Yeah, hello. Can you hear me?
I can hear you well. It's John here.
Hi, John. Nice to see you. I'm Matthias. I'm doing conferences, physical conferences, and the webinars for MDPI.
Okay.
And we have, at the moment, of course, all our conferences are virtual.
Yeah.
Also, the big conference we do once a year, the World Sustainability Forum, and the one in the background. And but we plan a big event next year in Basel, hybrid or virtual or fully physical.
So where are you sitting now? Are you in Basel or?
In Basel, in Switzerland, yeah. Basel, Switzerland, yeah. Okay. And you?
I'm in Bodø in the north of Norway.
Oh, okay.
I normally work in Trondheim at the NTNUs, but
okay. Mm-hmm.
I've been sitting here for 2 months now because of the virus, you know. So
okay, yeah. We are over, so most of the lockdown measures are lifted.
Okay.
We have at the moment between 30 and 60 new infections per day.
Mm-hmm.
So we have to keep, of course, the social distancing and other measures, but we do not have. You do not have to wear masks, etc.
Yeah.
I mean, we've had quite a paradise lockdown here in Switzerland, to be honest.
Okay. Now we are very lucky here as well, you know. So I have to use my mask when I go into a plane. That's all.
Oh, okay. Yeah. No. Yeah. That's the same here, but not in the shops. Not.
No.
Not in the public transport. Okay. So I will. So I have done yet that. Hi, Charlotte.
Hello.
Hello.
Hello. Nice to meet you.
And yes, and but there was just today that they have found a new virus, swine flu. It was in the media. So I've contacted the authors of these papers. It's published in PNAS, and so they have to monitor this virus too. It's a pretty difficult name, so quite a long name, but yes, it has had a tremendous impact here in Europe and all over the world, and it has never happened. I mean, for me, I'm 59 years old now, and this was special experienced.
Yes, it's the same with me. And I have been working a lot in Africa, and there we have
Okay.
very special challenges this time. Yeah. So I think there will be some big social problems with food security, food availability, and such things.
Yes, this will be a major topic of the World Sustainability Forum this year, food and agriculture. And we have quite a large virtual delegation from Sub-Saharan Africa.
Yeah.
Joining the conference this year. And we have been in 2017, we have been in Cape Town. That's also why we have such a large African group participating.
Mm-hmm.
So we wait. So we have Aki, and so we wait on. Just briefly, I will do a short introduction. I will introduce you and your colleague, and then we have the presentations. And after the presentation, we have a Q&A session, if you agree.
Of course. But you just tell me, how do I do to start my presentation? Is it a share screen or a technical thing? Yeah.
You can try it now if you want, just to make sure that it works.
So just tell me how to do it.
So you click on share screen.
Yes, I did that.
And then you have, if you already have your PowerPoint open, you can choose.
Yes, it's open.
So you click on it and you do.
So I click on my PowerPoint.
Yeah, and then you click share at the blue button in the right hand corner.
So now I click on my PowerPoint and then I share, is it so?
Yeah, exactly.
Here we are.
Yes.
Can you see it now?
Perfect. Yeah, we can see
Perfect,
it.
yes.
And then I will take care of that by myself when I present.
Yeah.
Good. But then now before I start, I close this now, or?
I can close it for you.
You can close it, and then you can open it when.
I can't open it for you.
No, but I can open it, so it's no problem.
Exactly.
Yeah.
And there.
Okay.
Yeah.
So then I'm ready. So if Giovanni will come, we will be ready, all of us.
Sorry. What?
There is one more. This Giovanni Gabutti,
Yeah,
or what?
he needs to join as well.
He's not yet, yeah. And so we have 220 people registered.
Oh, that's nice.
And but our experience is that about 50% will eventually join.
Okay.
So it's and they go in and out and in and out. So
yeah.
But,
sounds like a normal situation.
Yes. But we do record the whole webinar, and that will be posted on our website, so people can hear it and watch it later.
Good.
So, but what I mean, what effect had the special way of Sweden to Norway?
We don't know yet, because they have a slightly different policy for everything. The consequence is that people are not allowed to go from Norway to Sweden or vice versa.
Oh, okay. Still,
it's the first time in history that we are really stuck here, and a lot of people go to Sweden for their summer holidays. So
okay, yeah.
This year it's impossible.
Impossible.
Yeah.
And but they will continue this this way, or I guess
You
so.
know, as long as they have quite high incidence now,
Yeah.
then they will not open the border. You know.
Mm.
And in the north of Sweden, it looks like that's the worst place per
Okay.
day. Yeah.
Oh, I didn't know that. Yeah.
Oh.
Because it's a 24-hour stay, yeah.
Oh yes, and you know that's also one of my other lectures. I've been working with Arctic health for many years. You know.
Okay,
and,
very interesting.
and of course, then it's not sparsely populated, but people live very close in houses. Indoor climate is perfect to spread the virus, you know.
It's the same in Italy.
Yeah.
Yeah, the Italian, they have just another way of living together and hugging each other and big families.
This is really the Arctic situation as well, you know.
And here in Switzerland, we lock our door in the evening.
No, it looks like the culture has a lot of impact on the spread of the virus. Actually.
Yeah. So shall we remind Giovanni? Yeah, let me see. I will send him another reminder quickly.
Okay.
Yeah, just done. Oh, here, yeah. So,
hello, you hear me?
Oh yes.
Yes,
Hello.
we can hear you.
Hello, good
Hello.
afternoon.
Giovanni Gabutti from Italy. Hello.
Hi.
I'm
Nice to
John
see
from
you.
Norway.
Hi.
Hello.
Hi. So I'm Matthias. I work for MDPI.
It's a pleasure to meet you.
Pleasure to meet you. So, and again,
Okay.
you're in Italy right now.
Yeah.
Perfect.
I don't know if it's a bad line. It's mine bad line or yours. I don't see you very well. Do you hear me properly?
Perfect.
I can hear you well.
Yes, very well. So it's and also the video seems to be good and stable.
Okay.
Would you like to try sharing your screen or?
Yeah, I try. So we can try. I open my. I wonder.
Perfect. Yeah.
Do you see my presentation? No.
Yeah.
Yes, we can
Very
see.
well.
Yeah.
Yes.
Do you see also if I made a wider?
Yes, we can
Yes.
see it like that.
Okay.
Perfect.
It's okay.
Yes. Yeah.
Okay.
Perfect.
Perfect.
Excellent.
Okay. Now I have to go out to stop sharing, right?
Yes.
Because
Exactly.
Professor Odland speak first, right?
Exactly.
Okay.
Okay.
So okay. Yeah. Yes. Yes. John, you first, and then Giovanni will follow, and then we have the Q&A session moderated by Charlotte. And so how long do you think? I mean, we've made the experience that an hour after an hour, people tend to leave.
Yeah. See, I don't know how long this will last because I made this presentation yesterday, so it's the first time. But,
okay, so
hopefully 20-25 minutes. We'll see.
That's perfect. And so if you have unanswered
from my point of view, 15 minutes more or less.
Okay.
Okay.
Perfect. So if we have many questions, so can we send them, if not all are answered, can we send them to you by writing, and we will put the answers to the to the website. Is that okay?
No problem.
Okay, perfect.
Thank you.
Thank you very much. And it's an honor to have you both here today. It's the 8th webinar on COVID. And so it's a quite interesting experience also for us to do this. And it will have an impact on the future way of organizing conferences, I guess. That the model of hybrid conferences will be a standard, I guess, for all the future activities. So we have 9 minutes, and Charlotte, do you have anything I forgot?
No, I think you said everything.
So Charlotte, where are you?
I'm in Basel as well.
Oh yeah, so you are in the same office, or no?
Oh well, Matas is home officing,
Yeah.
and I'm actual officing.
So we have still 50-50. So 50% we are in the office and 50% at home. That not too many. That the place, the office is not too crowded.
Yeah.
And that we keep the distancing. But we work closely together. So and we are a team. So me and Charlotte and me. And yeah. So, okay, I will also have, so what we are looking for the World Sustainability Forum is we would like also, but I will send this information later on by mail. We are looking for a session on COVID, of course. So we have 3 topics. We have food, agriculture, as I mentioned that. We have transport and mobility, and we have health and Charlotte, health, huh?
Just health, yeah.
Health and yeah, and as a topic for this year's conference. So. When do you think we should start? So we do about 2 minutes before that the first people can.
Yeah.
Good. And I will also, when we have 50 in, I will start with talking.
Okay. So this will also be broadcasted on a Chinese platform, so our colleagues in China can watch it.
I have to tell you before we start, I should have been in Harbin in China just now.
Okay.
Because, but of course, everything is closed because of the virus. But we have a summer school in Arctic health.
Okay,
so,
interesting.
So maybe next time we can do that. So I have to do it virtually next week. So I will also teach Harbin next week in a totally digital version.
Okay.
Yeah.
Interesting.
So we find a way anyway.
Yeah.
Yeah, but as I said before, this will probably be the standard for this long distance contacts. But it's also sometimes necessary to meet in person.
Oh yes, we have to. Yeah.
Okay, so what do you think, Charlotte?
You can start broadcasting if you want.
Yeah. Mm. Okay. Mm. So I will then start exactly at 3.
Okay.
Mm.
Okay, just a technical question. Is the light behind me okay, or should I switch off something?
No, it's fine.
No, it's
Okay.
fine.
We can see you clearly, so
That's good.
it looks like a very nice house.
It's a map of Russia behind me.
All wooden like that is lovely. I really like it. So I'll switch my camera off and come back later.
Okay.
Good afternoon and welcome to the 8th MDPI webinar on COVID-19. Today's topic, impact of COVID-19 on routine immunization, reproduction, and pregnancy outcome. We have the great honor and privilege to present 2 top experts. Professor John Owen Oland. John is Professor of Global Health at the NTNU, the Norwegian University of Science and Technology. Specialist in GYN-OB, environmental medicine, and epidemiology. He has worked with mother-child programs in more than 20 countries. These days, focusing mostly on the Arctic, Southern Asia, and Africa. His studies have mostly focused on environmental and infectious disease impact on fetal development and pregnancy outcome. He has a scientific production of approximately 200 peer-reviewed papers and is now working with a new study on impact of the COVID pandemic on healthcare workers, the healthcare system and the general population in Southern Africa. John will talk on pregnancy and COVID-19 updated knowledge. And as a second presenter, we have Professor Giovanni Caputi. Giovanni is Professor of Hygiene and Preventive Medicine at the University of Ferrara, Italy. Specialist in hygiene and preventive medicine and in microbiology and medical virology. He has worked and still works on epidemiology and public health. His area of expertise includes epidemiology and prevention of vaccine-preventable infectious diseases. He has been involved in several RTCs on new vaccines, as well as research project promoted by the ministry. He is chief of the Postgraduate School of Hygiene and Preventive Medicine, University of Ferrara, and has a scientific production of approximately 170 peer-reviewed papers. Giovanni will talk on the impact of COVID-19 on routine immunizations. The house rules today. If you have any questions, please feel free to post them in the Q&A box. The Q&A session will start after both talks. Our speakers have also kindly accepted to answer all unanswered questions in written form. We would like to remind everyone that this webinar is recorded. The recording will be made available as soon as possible and will be posted on the webinar's webpage. If you are interested in submitting your paper to the relevant special issue in IGE or PH, you will get in touch with us. The COVID-19 pandemic in Europe response to challenges, please get in touch with us. At the very end of this webinar, we would like to present the current update of the coming virtual 8th World Sustainability Forum. We are particularly interested to run a session panel on COVID-19. John, the virtual floor is yours. Thank you so much.
Thank you very much. Let me see where I am. That's my share. Yes, I have to find out all these things. Yes, here we are. Can you see it clearly now, I hope? So, well, you already presented me. I'm from the beginning, I was a clinical doctor. Then I started with epidemiology, environmental medicine. I'm still having a strong link to my to my clinic. So that's why I've also put in some pictures of pregnancy as a serious matter, whatever age you are in. So we will talk about a little bit of the basic science, what we do, and I also want to share with you some of the thoughts a regular pregnant woman will have in this time. It's a very critical time for all of us. So we will just start with the very beginning now. This is the first what happens in the reproductive side. This is the sperm that is penetrating the egg. At this time, there are 50 million sperms dying behind this, and he is losing his tail in this minute. And a lot of things can happen here. We reckon that maybe 15 to 20% of fertilized eggs ends up with a spontaneous abortion. So it's a really serious matter to become pregnant. After only 1 week after conception, the placentation starts. And that's where we start also with the so-called exposure windows for external effects. Placenta will function both as a facilitator and barrier. And then there are a row of drugs, viruses, bacteria, parasites. They can penetrate depending on the time in pregnancy. I think most of you have heard about viruses like rubella that can make serious malformations at different times in the first trimester. You heard about the thalidomide story, where that was a drug that could induce malformations. Some of the toxic elements, they can cross the placenta. And the nutrients can also, in principle, cross the placenta. Some of them are transported intact. Some of them are partially metabolized or consumed. And some are blocked as well. I'll just show you some examples here what can happen, because the fetus is partially protected, but if you smoke 30 per day, then it can happen to get a placenta like this one, totally destroyed in the week 34. And also certain pollutants can have impact, and certain infections, of course. So, and also this placenta barrier, it changes a lot. Like the virus is mostly in the beginning of pregnancy, and then the pores open, and you can get like the transmission of syphilis, and so just as an example, after week 20. So there are different problems during the whole pregnancy. As an epidemiologist, you can do a lot of interesting studies on the placenta barrier just to use cord blood and maternal blood. This is how cadmium is almost blocked up to a certain threshold by the placenta. But if you, so you see the cord blood is almost nothing, but the mother has different levels of that. Very much connected to smoking. And then, of course, some if you look at the cord and the maternal blood again, you see that for certain, like a lead, for certain organic pollutants, and for most of the nutrients, then we see that there is almost a complete transfer. But it's much more complicated depending on the chemical structure and so on. So that is not the main topic for today, but it's really interesting in itself. So then that brings us up to what we know about pregnancy and the coronavirus today. Pregnant women might be at increased risk of a more serious course of certain viral infections. We have the case of influenza, we have the case of rubella, but we do not really know yet what if this is the case for a disease caused by the coronavirus. So far, based on the available information, it looks like pregnant women seem to tolerate the virus well. And also that the pregnant women are not especially vulnerable to a serious development of the disease caused by the virus. But possible complications are now explored in quite big studies around. We look at the gestational age, if the fetus comes too early. We look at the placenta damage. We look for small for gestational age, prematurity. One new aspect that has come up the last couple of weeks, actually, that is preeclampsia. This condition is looks like it's impacted by the virus, and also the cesarean frequency. But it's so complicated with all this social issues around this, because this is not only biology, this is not only physiology, it's a lot of social circumstances we have to take into it. And then I put myself into the shoes of the pregnant teenager. Should I take special precautions? To prevent infection, you have to follow the same advice as the general population. No need to take special advices just because you're pregnant. And if you have a chronic disease or pregnancy complications, then you have to discuss it closely with your doctor, where it's need to take additional precautions, and especially if workplace adjustments are necessary. But that's also more like normal for a pregnancy with complications. Like from my many years as an anesthesiologist, I know that a nurse or a doctor who gets pregnant, you should of course stay out of the environment where we have anesthetic gases and such things. This is what we have learned the last couple of years. And so anyway, it's very general what we think about. But then comes the question, of course, can the virus be transmitted to the baby prior to or during birth? We do not know for sure whether the coronavirus can be transmitted from the mother to the baby prior to or during birth. Several studies are looking at this now. But currently, it looks like you do not need to worry. Based on the present knowledge, transmission via the placenta has not been detected. nor has transmission from mother to baby during birth been detected. So, of course, in this situation, you can give birth in a normal way. But also remember the so-called exposure windows I started to talk about, where the beginning of pregnancy might be the most vulnerable. So, should I follow up my normal pregnancy checkup routines? Service activity for pregnancy checkup should be maintained as normal as possible. But you need to talk to your midwife or doctor and follow up the recommended checkup routines. And what can I do myself then? You should just do what I've told my pregnant women for years and years. Optimize your pregnancy situation by not too much stress, no alcohol, tobacco, or other drugs. That will prevent, and that's one thing, but it will also stimulate your immune defense, so you are not so vulnerable anymore. But if I suspect that I'm infected or feel sick, if you have symptoms of respiratory infections and you are suspected that you are infected by the virus, or you have been in contact with someone, you just go to the health services and discuss how this can be carried out. It's just simple public health work. So what happens then when I go into labor? If you're not sick or infected, births will proceed as normal. But if you have been in close contact, you will always be given a separate room. Staff will be wearing protective clothing, and there's a possibility to be asked to wear a face mask and so on. It's just general routines. Some people fear that they can be so isolated when they come into the delivery, but you can have visits under certain conditions. Visits should be really facilitated. That is the social side of what we talk about. We should never forget that when we talk about the public health or preventive care as well. But we have to register, we have to plan in a very different way. You see, one of the side effects we have seen in Norway is that the flu epidemics, they're almost gone because of this strong routines we have now. All other viruses, they have been at a very low incidence the last couple of months. And if you want to bring a birth companion, of course you want. It's important to facilitate the presence of a partner or someone close to you during birth and postpartum, of course. And then we come to after the birth. What do we know about the breastfeeding and the coronavirus? Breastfeeding is recommended even if you are infected or are sick from being infected by the coronavirus. It has not been detected in breast milk so far from women with corona infection, and it has been studied at quite a few places now. Relatively few infants have been reported with confirmed coronavirus infection. And of course, normally it's also shown to have a mild course of the disease. And then can the virus be transmitted from the mother to the baby during breastfeeding? We do not know yet if the coronavirus can be transmitted from the mother to the baby. What we know instead is that the breastfeeding protects the baby from disease after birth, as well as later in infancy and childhood. Breastfeeding protects against infections and is transferring antibodies from mothers to babies. So we really promote breastfeeding. So if you're healthy and without symptoms of respiratory infection nor diagnosed with COVID, you should really follow the general advice on breastfeeding that is very, very healthy for the baby. So we really promote breastfeeding in our public health advices. But if you have a respiratory infection or diagnosed with COVID-19, just follow the same general advice of breastfeeding and infection prevention, but continue to breastfeed. That's the dogma we have today. But of course, if you have the following advice should really apply to breastfeeding. Keep a good hand hygiene whenever you are in close contact with the baby. It's very simple. This is the old-fashioned routines. Wash your hands and try to avoid touching your breast to avoid transmissions from your hands to your breast, and of course then also further to your baby. When required, your breast can be washed with soap and water, but not use alcohol there. That could really irritate and could make also to make sore skins or nipples and so on. So avoid coughing or sneezing onto your baby. Of course, this is what we should do in any way. If you cough or sneeze, please stay out of the reach of the baby. Another thing that we really need to know when you come home with a new baby, clean your home frequently, including washing, disinfection of surfaces, also door handles, mobile phones. I have to say that I've done my full practice as obstetrician all the time during this period. But we are also cleaning whatever surface, any door handle, any whatever thing we do, my blood pressure equipment and so on. It's cleaned carefully between every patient. So there is a slightly smell of alcohol from me when I come home from work. And that's not because I'm drinking it. So that's all. And now I need to go in for landing as the time is running. I have some more overall worries for future. I have spent many of my years working in Russia. And in Russia, we have this so-called permafrost. It covers almost 70% of the Russian territory of the north. Arctic health is a big task for me. And if you have seen pictures of Siberia of today, there are huge fires because it's really heat coming up. And what happens then? This is what happens. The tundra is melting. And then you can imagine what happens for the future, the coming years. Will we see some new viruses coming up here, those we have never seen before? There has never been such open spots in the tundra. There might be viruses hidden, bacteria hidden, insects, of course, they have a paradise to make new, to transfer virus, bacteria, even vectors, parasites, and so on. So this is really the brave new world of what happens if you don't take this climate thing seriously now. So that's more like an overall. So I'm really turning now from the daily life of a pregnant into the global perspective here. What's going to happen if you don't take care of this for future? And then comes what to think about how can we travel in a COVID time? And of course, this conference today, where we do these webinars and so on, it's also a new perspective of how we can arrange contact and so on. We have already started to do electronic conferences on a bigger scale, but never forget that sometimes you really need to see each other physically. So this is, there must be a mixture of this to survive. So now I'm coming in for landing too. The Arctic dilemma, that is, we get the good food into the baby together with the dangerous substances like the organic pollutants and so on. In the tropical dilemma is that the temperature is increasing. We have to use more toxic substances like DDT. If not, you die of malaria. And the big issue coming up, and I really hope this sustainable development conferences can take up, that is food availability and food security. And this small baby lives in the Arctic, and here comes the huge problem for the tropics. People are so close, it's impossible to prevent the huge spread of the virus if you're not careful. So that's how it happens. So good collaboration is crucial. The studies coming up, they're into what I've talked about now. We are mixing epidemiology with basic molecular science. And of course, good collaboration is crucial, as you can see from this nice picture. So this is just some of my Arctic friends. So thank you very much for attention. Thank you.
So thank you very much. And now, so Giovanni is online, and please, the floor is yours.
Okay, good afternoon to everyone. It's really a pleasure and an honor to be here with you and to have a brief talk on the impact of COVID-19 on routine immunization. Before starting, I would like to share with you the disclosure of my conflict of interests. And I start with this kind of data. If we look at the impact of COVID-19 all around the world, it's quite clear how many countries have been involved in such a big disease. And many cases has been registered all around the world. And COVID-19 has hindered in many countries the routine immunizations. This means that more or less 80 million of children under the age of 1 are now at risk of serious diseases such as diphtheria, measles, poliomyelitis. And in this respect, over half of 129 countries had a moderate to severe and even a total suspension of vaccination services. This table tries to summarize what is going on in the world, and we can see that the most affected vaccination has been related to immunization with MMR and poliomyelitis as well. And this means that we have to think about which are the reasons for discontinuing vaccination services. And as you can see, the reasons are quite several. First, the social distancing measures that has been introduced to avoid the transmission of COVID-19, as well as the fear of parents leaving home. But we have to remember about the difficulties of healthcare workers to move, to travel, and in many cases there has been a great commitment of health professionals in the management of the epidemic. And also there is been a delay in delivering many vaccines. So the WHO at the end of March of this year has published these guiding principles for immunization activities during the pandemic. And the main messages are the following. COVID-19 and its burden has greatly hindered the vaccination services, and there is a relevant risk of disruption of routine immunization activities due both to the COVID and also to the lower demand for vaccination because of physical distancing. And this means that we are facing the real risk to have an outbreak-prone vaccine-preventable diseases. This is particularly relevant for and evident for measles, but it implies more or less all the possible immunizations that we can do in our children or in our population. And these outbreaks would imply also a risk of an increased morbidity and mortality. For this reason, WHO says that we have to make a great effort in order to try to maintain the continuity of immunization services and obviously to make this continuity and allow to work under safe conditions. And we have faced in the past some health issues that had an impact, but for sure COVID-19 has been an unprecedented risk for the public health. And from this point of view, the WHO identifies 7 guiding principles. The first one is that immunization is a core health service in any part of the world and in any time. And we should work hard in order to maintain vaccine preventable disease surveillance, and we have to reinforce even during the COVID pandemic. And any country should work a lot in order to monitor, on one hand, the dynamics of COVID-19, as well as the coverage rates. From this point of view, WHO recommends to temporarily suspend mass vaccination campaign and to design as soon as possible strategies for catch-up vaccination from the post-pandemic period. And there is a special recommendation for healthcare workers, older adults and pregnant women for influenza vaccination, and that is strictly recommended and advised. So in the future, WHO recommends to work a lot in order to, in the near future, restart as soon as possible with vaccination intervention when and where this has been suspended or have decreased. And from this point of view, it's not strange that also the European Office of the WHO has pointed out more or less the same points. And probably the most important recommendation is to work in order to design and be ready for catch-up immunization intervention in order to restore the coverage rates that we had in the pre-pandemic period. So what are, from the WHO European region point of view, the key points to have that have to be considered? The first one is we have to answer what is the potential risk of an increased vaccine preventable disease occurrence. And in any country should be able to answer the question, what is the transmission scenario of COVID-19 in its setting, and how health system immunization services have been affected by the COVID pandemic. And last but not least, do you have sufficient amounts of available vaccine in order to maintain and, if possible, improve your coverage rates? This is an algorithm made by the WHO European region. I would not like to go into detail in this slide, but just to point out that at least 5 possible scenarios has been identified accordingly to the impact of COVID-19 in each country, and how it has been relevant and how great has been the decrease in the immunization coverage rate. So we have at least 2 examples. I'm sorry because I can't see the picture, the figures, but probably you can see here in the small view. And these are 2 examples, one from the Europe and the UK in particular, and the lower one from the USA. And when the COVID has arrived, there has been also a dramatic decrease in the coverage rate of many vaccine-preventable infectious diseases. This is the situation in my country, Italy. As you can see, we have 20 regions, and we have almost many differences between regions. We had a total closure in one region. Many regions had a limited disease. Very few maintained the regular activity, and also some regions had not data available. And so it's very relevant to point out that we had this appeal of the calendar for life. The calendar of life is a scientific document published and subscribed to the principal scientific societies in Italy, and these scientific societies belong to the hygiene and preventive medicine, public health, the pediatrician, and the general practitioners. And the appeal of this working group points out that it is absolutely important to maintain increased vaccine coverage rates in children and in all the population in order to avoid to add new epidemics related to vaccine preventable infectious disease to the ongoing pandemic of COVID-19. I should mention that in Italy, before the COVID period, we had more or less a quite good coverage rate, but we had the need to implement and to increase this above the 95% of coverage rate. The key points identified by the working group of the calendar of life are more or less 5. The first one is to ensure coverage for all newborns and the calls, both for the pediatric and the adolescent ages, and to not interrupt active course and scheduled session. The second one is to reorganize the methods of offering pediatric and adolescent vaccination. And for example, this second point looks also at the co-administration of more than 2 vaccines together. There was use more than 2 vaccines together in co-administration. Now we are wondering if it's possible to work with at least up to 5 vaccine co-administered together. The third point is the planned recovery programs for vaccination not carried out after the start of the COVID-19 emergency. The fourth point is to provide regions and autonomous provinces to have an adequate supply of flu vaccines. This in order to face the possible impact of flu during the possible second wave of COVID in the next autumn. And then to design and plan catch-up strategies in order to increase coverage rates for flu, pneumococcus, tetanus, diphtheria, pertussis boosters, and herpes zosters as well. And from this point of view, I would like to share with you the new last recommendation for the next flu season in Italy, in order to point out that probably we want to work very strong in order to increase the coverage rate, to involve in the vaccination routine also the pediatric age group, and we are looking for not only the recommendation but also for the probably future mandatory vaccination against flu for healthcare workers. So the last document by our Ministry of Health is related to the a specific investigation into the impact of COVID-19 emergency on vaccination activities in order to understand how much our coverage rates have decreased. In some webinars I attended, I heard that in some parts of the countries we have lost up to 10 points of coverage rate. And this is a huge problem, because if this is not solved, we will have in the near future, in the middle future, some possible outbreaks of vaccine-preventable infectious diseases. So this is my last slide and some kind of conclusion. And it's from this brief talk, I hope that it's absolutely relevant to keep the vaccination coverage rates high in all age groups of our population. We have to immunize the children against the flu. We have to remember that we have to catch any opportunity, and that any missed opportunities might not reappear. And we have to work very strong in order to increase coverage against flu, pneumococcus, zoster, and the Chenel TDP boosters, and to lengthen the period for seasonal vaccination. And the last message is that if getting vaccinated is always very important, it is even more important in the perspective of a possible second wave of the epidemic of COVID-19. Thank you so much for your attention.
Thank you very much, Giovanni. Thank you, John, for two very interesting presentations. The Q&A session is now open, and I have seen that John has answered questions linked to his presentation. So there is one for Giovanni asked by Josephine, and it says, about vaccination, which strategies are being put in place to mitigate effects of negative information surrounding vaccines? For example, in Africa, people are fearing the upcoming COVID-19 vaccine, saying it is meant to kill Africans. Social media is awash with such scares.
Probably we have a different problem. People are asking for vaccinations, in particular for COVID vaccine. They wonder and ask when it will be available. I'm not so sure that when it will be really available, all people will want to be vaccinated with this kind of product, because the problem is all the same. We have a great fear of what is unknown, and COVID-19 is greatly unknown. But when we have the available vaccine, we wonder if it's safe, it is efficacious, and so on. I'm pretty sure that any company that is working on this kind of vaccine is working hard in order to have a product in line with our request in order of tolerability, safety, and efficacy. If it will work like that, it will probably be a great point, and I hope that we have the opportunity to use this in a wide part of our population. From other vaccinations, I'm not so sure that that people are looking for maintaining the coverage rates. They have a great fear about vaccines in general, but a great fear to catch COVID because they are going to the immunization services. And from this point of view, our Minister of Health has made some reassuring documents. And if you are allowed to go to the immunization survey, you have to be pretty sure that is a safe practice.
Okay. Then we have one person who's raising their hand. Liz Melissa Yapanto. I'll just allow for him to speak, so they might have a question. Hello, Liz.
Can I comment a little bit on Giovanni while you are thinking about
Sure,
it?
go on, go ahead.
Yeah, because in Africa, this cultural question is a huge thing. You know, and if a politician is talking about the wrong way, like an old president said he could shower after an HIV contact or something like that, it has impact on people. So this will be a challenge for us in the years to come, even if we get the vaccination campaign ready for us. So the cultural aspect is always difficult in Africa. Thank you.
Yeah.
Right, and now we have Yahaya Yakubu who has raised a hand. So let's see their question. Yahaya, you can speak. Not coming through, apparently. Okay.
Hello, can you hear me?
Yes, we can hear you. Yeah.
Okay, that is a wonderful, a very good presentation there on the impact of COVID-19 on vaccination. Yeah, what I want to say here is that particularly in Africa, where we have very low level of acceptance of vaccination due to the cultural issue, social issue, and of course, religious issue. I think, to my understanding, the lockdown during this pandemic is an avenue or an opportunity for health workers to be able to go around. Because here in Africa, particularly I'm calling from Nigeria. Here in Nigeria, vaccination is normally house-to-house activity. Health workers go from house to house in order to give vaccination. So I think during this lockdown is an opportunity in order to have a very wide coverage, particularly here in Africa. If the institutions are really very serious, I think it's an opportunity for them to take on, because everybody is at home, there's lockdown, and health workers that are into this vaccination are providing essential services. So normally during lockdown, they have been allowed to take on their activities. So I think it's an opportunity. We are looking at the negative aspect, but here is a positive opportunity for the institution to be able to utilize the period and ensure wide coverage of vaccination, particularly those that has to do with other diseases. Thank you very much.
Thank you.
And then Shaista Afridi, who's also raised their hand. So I'll just let them talk. Shaista, you can speak. If you want to. Hello. Okay, well, never mind then. So we have another question in the Q&A box, which is, vaccination normally takes long to address that it's safe for public use and its adverse effects. Doesn't it seem that it's too early to say that the vaccine is discovered? Giovanni, I guess that's for
takes
you.
a long to address that is. Yeah, you are right. The time needed in order to design and develop a new vaccine is usually very long. And for example, we need more or less 10 years, 12, almost 12, 15 years in order to develop, design and develop a new vaccine. But when there is a pandemic, probably the efforts has been made in order to accelerate this kind. This does not mean that we have already a new vaccine that is ready for use. This means that many companies are working in order to achieve as quickly as possible a vaccine whose characteristics should absolutely be safety, tolerability, and efficacy. Up to now, we do not have any kind of this product, but we know that some companies are working very hard, and they have started already some studies even in the man, and probably the production is and the development of this new product is going on more quickly than we are used to do.
Okay, great. Thank you very much. There are no more questions, so this is the end of the Q&A session. Thank you very much, both John and Giovanni, for your time and presentation. It was much appreciated and very interesting.
Yes, thank you very much.
Thank you.
So, yes, so I will have a very, very short update on the coming World Sustainability Forum. Just let me try to share the screen. Where is it here? So, where is it here? Can you see it?
Yes.
Yeah.
Okay, let me quickly close that and go. Perfect. So as I mentioned in the beginning of the webinar, we are organizing the 8th World Sustainability Forum, this time virtual here in Basel due to the COVID pandemic. And we are also at the same time organizing a hybrid format for the next year in 2021 in September. So everybody is invited to register. It is free, and the format will be like a normal conference with breakout sessions, with keynotes, and we are this week working on the program together with the chairs, and the program will be available early next week online at WSF8 SciForumNet. So at the same page you have the information about the webinars. So we have a number of very famous keynote speakers like Professor Mike Mann. He has developed this hockey stick theory on climate change, and we have an old friend of ours, Matthias Wackernagel, the co-creator and the president of the Global Footprint Network. So we are particularly interested to run a session panel on COVID-19. So if you have an idea or if you're interested to organize such a session, please get in touch with us. And we have a number of partners and corporations which covers this event this year, and save the date for the 9th World Sustainability Forum, which will be held on from the 13th to the 15th September 2021 at the brand new Biocenter in Basel at the university. Thank you very much. And Charlotte, you have the last word.
Thank you, everyone. As we mentioned, this webinar is recorded, so it'll be uploaded in the next few days. You'll get an email informing you when it's available. Thank you again to our speakers, and thank you,
John, Giovanni. Thank you very much.
Have a nice.
Thank you. Have a nice day. And
thank you. Bye bye.
Stay healthy and safe. Thank you. Bye bye. Bye bye.
Bye.